So Radio Healthcare helps in the quality assurance space within the company because we're able to access all the different sections of the system, such as risk management, incident reporting, and that allows us to make sure that we're holding ourselves accountable for different changes that we need to make within the company to improve our processes, and obviously then that leads to improved patient outcomes as well. The usability and functionality aspects, sort of night and day compared to previous systems that we've used. The ability to be able to roll it out to multiple different staff groups and pick it up really quickly just shows how the functionality is really sort of simple, but at the same time provides us with really sort of intricate and detailed information that we can use to improve our practices. The ability to sort of pull together loads of different data and insights from different sort of areas of the business into one central hub is really useful for those slightly larger, more sort of business continuity improvement plans that we want to make from the quality space. So it just allows us to present any findings that we find much more easily to sort of the board, senior leadership team, and that sort of thing, which just makes everything a lot easier. So the first thing that's the most important thing, I think, is creating a robust training package for your staff. It just means that the staff are able to hit the ground running prior to going live with different areas of audits or risks or incident reporting as well. Making sure that you have regular updates to any of the systems and making sure that you're adhering to any changes to regulatory compliance as well. Involving stakeholders early as well in the process is really, really useful. And getting that feedback every step of the way from not only the staff that are completing the audits or putting in incidents, but also from Radar Healthcare as well. And making sure the relationship with the support team that Radar Healthcare provides and having regular updates with them as well can really help to sort of push any changes that you want to make and ensure that what you are going to implement is going to benefit the organisation as a whole. So we have weekly calls with Sarah, our Radar Tech Support magician, and yeah, so by having those sort of regular catch-ups, those regular updates and our sort of project plan that she creates for us, it means that we can keep on track with any sort of rollouts of various different sections of the business prior to sort of going live with sort of any improvements or changes we want to make. The support team are really helpful, really responsive to emails and calls as well. Sarah's really, really good at putting us onto the correct people based on the different changes that we want to make. So if we've got a specific change that we want to make within the analytics, or if there are any issues with the functionality that we want to change, everything's really customizable. Having that sort of support behind the scenes enables us to sort of push the boundaries more about what we want to change and what we want to achieve. Being able to pull all of the data that you need into one sort of pot and then using that data immediately, which Radar Healthcare already does for us, can then mean that we can sort of be more efficient in sort of actioning any changes, tracking any sort of underlying issues or underlying concerns that we've got across various different parts of the business, which audits do pick up. And then we can mitigate those risks as well in other areas of the company. I love the graphs. The analytics part of the Radar is my favourite bit so far. Yeah, absolutely. It just produces information in a really sort of easily digestible way. So when we're pulling reports, like I said, for the Safety, Quality and Leadership forums that we have each month, and also for the senior leadership team and the board packs and things like that, by having a really easy to understand graph, it can show any trends that we've got and also any areas where we are performing exceptionally well, and also any areas that we may need to focus on. So it provides us with a sort of a really nice snapshot of how we're doing in various different areas of the company. And I think, obviously, like I said, everybody works slightly differently. So it's really nice to have that functionality where you can either pick to create an Excel sheet or a PDF, or create a number of different graphs with different trends. You can drill into each section of it as well to give us more of an in-depth view of that area. So it's just, yeah, the usability is really, really nice. So my previous clinical experience has been really beneficial when sort of leveraging the systems that Radar Healthcare provides for us. I've been a therapy radiographer in the NHS, and then also for 5 years with GenesisCare prior to starting this role. And using those cutting edge technologies, treatment techniques involved in radiotherapy treatment, chemotherapy treatment, theranostics treatment, I can really sort of see the difference in the processes that we use, and also the end goal of sort of improving the patient health outcomes at the end of the treatments. So having sort of a diverse clinical background within our quality team and using Radar Healthcare to implement any changes that we want to these clinical systems that we have, you can really see a benefit when you actually go on to sort of shop floor clinical treatment. Having access to the data in such a centralised area means that there's not really anything much better currently out there. The organisations which use potentially slightly more outdated systems aren't going to be able to track or analyse the data that they are creating from various different audits or risks or incidents that are being populated in the system. So by using Radar and leveraging all the systems that it has, it can improve the overall compliance of the organisation or company that's using Radar Healthcare. Since I qualified 12 years ago, there's been massive changes in terms of the clinical treatments that we can give to patients, especially within the radiotherapy workspace as well. The technological advancements that you get within that craft group change year on year. And GenesisCare is at the forefront of those changes with implementing things like the MRL treatment machines that we have now in the company, and also the different types of treatment machines that we are constantly looking to update, renew our services across all 14 sites that we've got. So the reporting processes back when I was in the NHS were very sort of archaic. So it was quite a lot of paper reporting and also quite a lot of inputting lots and lots of information into forms that were built into the NHS's reporting system. So I feel like it's definitely come on in leaps and bounds. Obviously, when I first started with GenesisCare, we were still using a relatively old quality management system, which served a purpose. However, the actions weren't going to the correct people, or they weren't assigned to the correct areas that needed those prompts to make any changes that we needed. So having a system like Radar Healthcare that is a sort of an all-encompassing system allows us to make sure that those actions are completed and any improvements are made sort of very quickly. Well, like I mentioned, that it's obviously come on leaps and bounds in the last decade or so. Generally, in terms of radiotherapy, we're trying to make sure that the treatment schedules and the number of treatments patients have to come for is reduced as much as possible. So we're going to have more hyperfractionated radiotherapy treatments, using sort of new age immunotherapy for patients going through things like systemic treatment in terms of chemotherapy. So I'd probably say in the next 5 or 10 years, we'll be looking at single fraction treatments for all body sites and all tumours, leveraging that more sort of up-to-date systemic treatment pathway that can give to patients is something that obviously GenesisCare is at the forefront of. And that is with the end goal of improving the patient outcomes.